Well, good evening, Lupus Warriors all around the world, and welcome to another video brought to you by the Laura's Lupus and Support channel. If you enjoy the content that's provided here on this channel, please take a moment to like and subscribe. I guarantee you will not be disappointed. This is a community that practices inclusion. We try to understand, the journey and where each person may be on their lupus journey. We offer a lot of love and support, and we advocate for, for everyone that's a part of this community. I guarantee you will enjoy the experience. Um, we invite, comments and different points of view. We invite different experiences because all together, we make a strong community. And one cannot, you know, walk on this journey alone. It always helps when we have the support of our brothers and sisters and when we walk together. So we are stronger together. Okay. So, anyway, it's Friday. And on Fridays, I like to bring you a Lupus Facts Friday video. That's a mouthful. And, it's a video in which I bring you maybe, between 5, 10, maybe 15 facts regarding lupus. And so on tonight's video, I'm going to talk about a sister of lupus. Yes, lupus has a sister. As a matter of fact, lupus has several brothers and sisters, and they all fall under the umbrella of autoimmune diseases or autoimmune disorders. But tonight I'm going to be talking about a specific sister of lupus, one that loves to tag team and coexist in the life of a lupus warrior at the same time. And so that answers the question, can you have more than one diagnosis of an autoimmune disease? And the answer is yes. Yes, when you start off as a lupus warrior, you may just have the diagnosis of lupus. But as you continue along this journey, you may start to see that there are some symptoms that show up that don't fit under, a symptom that you're accustomed to that would be a part of lupus. So you call your doctor. Your doctor has you to come in for a visit, run some tests, and guess what? It comes back that you have acquired another autoimmune system disease. So yes, you can have one or more autoimmune system diseases coexisting inside one lupus warrior at the same time. But to get into the video, we're going to be talking about rheumatoid arthritis. Rheumatoid arthritis. And yes, rheumatoid arthritis falls also under the umbrella of autoimmune diseases or autoimmune disorders. And it can coexist with lupus at the same time. As a lupus warrior, I think we get accustomed or we start to adjust on this journey to juggling medications, juggling symptoms, juggling diagnosis, juggling tests, and eventually sometimes we learn to juggle several different autoimmune diseases at the same time. But specifically getting back to the video, we're going to be discussing rheumatoid arthritis or RA. So I'll be using those terms interchangeably throughout this video. RA, rheumatoid arthritis. So what is rheumatoid arthritis? If you've recently been diagnosed with rheumatoid arthritis or you have existing rheumatoid arthritis along with your lupus, well, rheumatoid arthritis is an autoimmune system disease that impacts the joints of a patient. And those joints may experience pain, swelling, stiffness, and inflammation. And as you can see, pain and inflammation seems to be a commonality with most autoimmune system diseases, pain and inflammation. With rheumatoid arthritis, there's that ebb and flow in which a patient experiences a flare-up. Now, that's a familiar terminology with you lupus warriors. And remission. That's another terminology that we are very familiar with. And get this, rheumatoid arthritis also has Triggers. As a lupus warrior, we're all too familiar with the word triggers and what they are. And so, sometimes we have to juggle all of these. We have to juggle the ebbs and flows of each individual autoimmune disease. We have to juggle the triggers and know the triggers associated with, is it lupus or is it rheumatoid arthritis? Or could it be both? And so the tips that I'm going to give you tonight on managing rheumatoid arthritis, some of these you can also apply to managing your lupus symptoms. So let's get started. Number one on the list is know your triggers. I think that can apply to both lupus and managing rheumatoid arthritis. Number two, get enough sleep. On this journey, I've learned that, getting enough sleep is the best gift that you can give yourself as a person that deals with autoimmune system diseases. Getting enough sleep, having your body to rest as often as you need, and getting that deep sleep that's required to rejuvenate and, just refresh your body as a lupus warrior or as a person that deals with autoimmune diseases. Number three is exercise during the day. you know um, Exercise is a big one as far as managing your symptoms of RA. But get this, here's the caveat. If your body's feeling run down and you're experiencing a lot of pain, stiffness, and swelling in your joints, that's not the time to go out and try to run 2 miles or walk 2 miles. Do something that's light exercises such as Tai Chi, mild aerobics, and also studies have shown that swimming is really good for someone that's, trying to manage their RA symptoms. Number four on the list is eat a balanced diet, especially a low fat diet. That is one way to help manage your symptoms. Um, there's a big correlation between, what we put in our bodies and, the symptoms or managing the symptoms of our autoimmune system diseases. Also, there's a big correlation between our gut health and autoimmune system diseases. So think about that for a moment. Number five is manage your stress levels. Learn how to decompress, learn how to say no, learn how to set up boundaries and not feel guilty about it. Um, have an outlet as far as how to de-stress, whether it's exercise, talking to someone, listening to, soft music, mindfulness, meditation, whatever you do, to help yourself along this journey to decompress and de-stress, that's up to you. But whatever works for you, make sure you do that. Number six is make sure to get your blood pressure level stable. Okay? And so if you don't have a blood pressure cuff at home, make sure that you get one. Make sure you know what your blood pressure readings are on a daily basis. That's really helpful. The standard for, what's considered the best blood pressure is anything 120 over 80 or below is considered the gold standard for a stable and a good blood pressure. So make sure that if you're on blood pressure medications, you're taking your medications as prescribed, but make sure that you keep your blood pressure at a stable level. That can help you manage your RA symptoms. Number seven, reduce your cholesterol levels. Okay. So, as a patient with lupus or with rheumatoid arthritis, especially with rheumatoid arthritis, you need to know your numbers. You need to know your blood pressure and you need to know your cholesterol levels. And, if your cholesterol is high, you need to be making sure to discuss that with your doctor and taking steps to lower your cholesterol. If your blood pressure is high, taking steps, medications, to reduce your blood pressure and get it at a stable, a stable level. And number eight, if you smoke, stop smoking. Smoking can have a horrible impact on your RA symptoms. It can make them worse. So if you are a smoker, take whatever steps you need to quit smoking. Okay. And number 9, take your prescribed medicines. Take them on a regular basis, daily as prescribed. Take the dose that's prescribed. Take your medications on the schedules that they're prescribed on. Because you know what, if you, with the ebbs and flow of, rheumatoid arthritis, and when you go into remission, and remission is a decrease of symptoms or no symptoms at all for at least 3 months. And so remission is possible with RA. Remission is possible with lupus. If you find yourself during a period of remission with your RA, it's very tempting to just stop your medications because you're feeling so great. My friend, do not stop your medications without first consulting your doctor. Okay, because stopping your medications will definitely cause your symptoms to come back, and they could come back even worse. Consult your doctor if you're feeling better. If you've been in remission for 3 months, medications can be, the dosage can be changed, reduced, but work with your doctor. Don't just stop taking your medications abruptly, because with autoimmune system diseases, specifically with rheumatoid arthritis, it's a chronic disease, which means that it's something that's been building up over a period of time. And whenever a person is diagnosed with a chronic disease, you know, basically it means that this person is going to deal with this disease for a lifetime. And so RA is considered a chronic, autoimmune disease, which means that you're going to deal with it for a lifetime. So don't just stop taking your medications because you're feeling better, because, the rebound effects could be even worse. Talk with your doctor about adjusting your medication levels, okay? And so I hope that the information that I provided tonight, I hope that it was helpful, informative, useful. I hope that, it gave you some tips that you can use, possibly for both lupus and for rheumatoid arthritis. And, as I always say at the end of every video, my friend, there is life after lupus. So take care of yourself. Stay as safe and healthy as possible. Stay encouraged. Stay strong. Stay blessed. Know that God loves you with all of his heart. And I will see you soon on the next video. Have a great weekend, my friends. Have a terrific Friday and a great weekend. See you soon. Bye for now.